Hello Physios, welcome back to Believe in Therapy. Today's topic is postures. Before we start topic, I want to all to understand one thing very clearly. Postures is not just about us standing. Postures is a reflection of how well the musculoskeletal system and nervous system are working together. So most of the patients you will treat in your clinical life like a neck pain, back pain, shoulder pain and a postural problems. So we'll have one common factors that is poor postures, right? So today's we are going to discuss postures in a biomechanics not only for an exam point of view but also from a clinical and practical perspective. Now start our introductions of a postures. So when we talk about a postures, we are talking about how the body maintains in a positions against a gravity. Always time human body is constantly fighting a gravity, like whether we are standing, sitting, or even walking. So, in the way our body organizes itself to face a gravity is called as a postures. So, postures is the alignment and the positioning of the body in relations to a gravity. So, postures is two types: good postures and bad postures. So, good postures means a minimum stress on the joints and minimum muscles effort, right? So bad postures mean actually bad postures like patients feel have a pain and fatigue, like a increase or load on a muscles, ligaments, joints. So postures like reflect in the balance between a muscles and a skeletal system. Good postures minimize stress on a joint and the ligaments, and poor postures lead to a pain, fatigue and dysfunctions. Okay, so I think as a clear. So now come to a definitions of a postures. So postures like defined as a positions of a body and its segments relation to each other in relations of a gravity, both is static and dynamics conditions. So postures is the attitude of the body, and postures is the alignment of body segment maintained via muscles activities, like muscles activities are anti-gravity muscles. Okay, so postures is the ability to maintain balance against a gravity. So postures is a broadly classified in a two types: static postures and dynamic postures. But first, good postures and a bad postures. So good postures, I think you clear like when the body segment are properly aligned so that like anti-gravity muscles work efficiently and joints are their optimal positions. Okay, like patients feel as a minimal strain or a supporting structure, so it's called as a good postures. And now bad posture exactly opposite. In a bad postures, like some muscles become a tight and overactive, so some muscles become a feel as a weak and lengthened, and gradually this imbalance produce pain and deformities. So bad postures like patients come to a clinic. So if you assess, so never ignore postures assessment. Okay. So now come to a static and dynamic postures. Static postures, as I refer to postures maintained when the body is at rest, like fixed positions. For example, like sitting, standing, or a lying. So body maintained in a fixed positions like a sitting, a standing, and a lying is called as a static postures. And second is a dynamic postures. So dynamic postures actually the postures maintained during a movements like walking, running, lifting any object, and a bending. So is a dynamic postures. Okay. So dynamic posture actually have a two types: active postures and inactive postures. Active postures require a continuous muscles activity, and inactive postures require a minimal muscular effort. So I think now come to a difference between a static and a dynamic postures. So actually, static postures means no movements, and a dynamic posture actually the movement is a present. So static postures like body stationary, and dynamic postures is a body in a motions. Static postures maintain a positions, and dynamic postures maintain stability and the movements. Right? Static postures in a sitting and a standing, and dynamic postures, walking and a running. So static postures have a less muscles activity, and dynamic is a more coordinations required. So I think as a clear and difference commonly asked in a short notes and MCQs. and commonly is a university exam. Okay, now come to our structures of our postural muscles. So structures of our postural muscles, actually postural muscles are specially designed muscles whose main functions is a maintain postures for a long durations, like a multipennate muscles and a fan shaped muscles. Okay, this type of structures like provide a strength and a stability because it's have like a type 1 red muscular fiber. So टाइप 1 मसल्स फाइबर एक्चुअली स्लो ट्विच फाइबर होते हैं जो कि फटीग रेजिस्टेंस है. That's why the postural muscles can work for a hour without getting a tired. Right? Means postural muscles actually is anti-gravity muscles. It's up like slow twitch fiber. So slow twitch fiber actually is a fatigue resistance होता है जो patients like a long durations like postures को maintain कर सकता है and postural muscles बिल्कुल भी फटिक नहीं होती, बिल्कुल भी पेन नहीं होते. सो कुछ कॉमन मसल्स होती है like type 1 fiber. Last points is a type 1 fiber are fatigue resistance and suitable for continuous contractions without any fatigue. So anti-gravity postural muscles like a example for a erector spinae muscles, gluteus medius muscles, quadriceps muscles, soleus muscles, neck extensor muscles. So these muscles are also known as anti-gravity muscles because they work against the gravity. Okay, so first point is these are muscles most frequently used to maintain erect postures. They counteract effect of a gravity and prevent the body from a collapsing. इफ लाइक एंटी ग्रेविटी मसल्स वर्क नहीं करेगी तो पेशेंट्स को चांसेस है फॉल होने के, बिकॉज यू नो ऑलवेज हमारी बॉडी पे हमेशा ग्रेविटी हमें पुल कर रही है, डाउनवर्ड पुल कर रही है, अपनी साइड खींच रही है. बट जो हमारी मसल्स है लाइक जो एंटी ग्रेविटी मसल्स है वो क्या करके रखे, वो हमें मेंटेन, हमारे पोस्चर्स को मेंटेन करके रख सकती है इन इरेक्ट पोस्चर्स. ओके, सो लाइक दिस ऑल्सो नोन एज एक्सटेंसर मसल्स एंड सो tonic activity and work for a long durations. So example of anti-gravity muscles like erector spinae muscles, like muscles maintain a upright spine, and quadriceps muscles maintain a knee extension in a standing position, soleus muscles maintain a ankle stability in standing, and gluteus medius maintain as a pelvic stability. So these all are muscles like extensor muscles. Okay, so main of favorite questions like examiner in a or other competitive exam like type 1 fiber and anti-gravity muscles. So please note down this. Now come to a very important part is postural control introductions. Like postural control, what is a postural control? So you know, like a postures maintaining is not like passive process. It's an active process, like a continuous process called as a postural control. Like you know, हमारी बॉडी पे हमेशा ही ग्रेविटी लग रही है तो पोस्चर्स को कंट्रोल करके मेंटेन करके रख पाना बहुत ही मुश्किल है. तो ये कोई पैसिव प्रोसेस नहीं है, ये एक्टिव प्रोसेस है. बिकॉज हमारी जो एक्सटेंसर मसल्स है वो ऑलवेज टाइम वर्किंग में, वो हमेशा वर्क कर रही है. एंड हमारा जो कोऑर्डिनेशन सिस्टम है लाइक सेंसरी सिस्टम, सेंट्रल नर्वस सिस्टम एंड मस्कुलोस्केलेटल सिस्टम, ये क्या कर रहा है, ये एज अ पोस्चरल कंट्रोल में हेल्प कर रहा है. लाइक postural control means the ability of a body to maintain a balance and alignment both during a rest and a movements. So I think as a clear postural control is not a passive process, it's an active and continuous process. Okay, so first point is refer to a person's ability to maintain stability of a body and body segments. Central nervous system regulates sensory informations from other system to produce adequate motor outputs to maintain control of upright postures. Okay, like this visual, vestibular and somatosensory system are a main sensory system involved in a postural control and engage in various static and dynamic activities. So these are all as introductions. Now discuss in a detail. First is a mechanism of postural control. So postural control achieved by three major sensory systems. Like first is a visual system, second vestibular system, and third is a somatosensory system. But all are controlled via central nervous system. Okay, so postures is controlled via coordinations between the muscles, joint, and the nervous system. Continuous sensory input is required to maintain balance, and body constantly adjust muscles activity based on your feedbacks. And this is called as a postural control loop. Discuss our first major sensory system is a visual system. Visual system actually, as a provide like informations and like surrounding areas. Okay, so visual system as a provide informations about a body positions and body orientations respectively to the surrounding areas. So that's why when you close your eyes, balance become a difficulty. Okay, so help in a orientations and a balance. Next system is a vestibular system. Vestibular system like present in a inner ear and detect as a head positions and head movements as controlled by a vestibular cochlear nerve. Okay, so this has become especially important during a movements like when your visual input is reduced. So vestibular system actually is a detect head movement and accelerations, and two type of movements like angular movements and linear movements, right? So angular movement as a detect by a semicircular canal, and linear movement as a detect by a otolith organs. So these like the vestibular cochlear nerve as a send signals through a vestibular nerve to maintain balance. Okay, so now come to a third somatosensory system. So this system provide a feedback like from a muscles, joints and skins. So this are like telling the brain about the body positions and the maintenance. Okay, so include like tactile sensations, touch, pressures from a muscles, from a joints, and joint receptors sense like weight wearing and the joints positions. And the skin receptors like a provider feedback about a surface to the contact, like skin surface contact. Okay, so joint receptors sense like weight bearing and joints position, and skin receptors send us signals like a skin surface and feedback. So all this information is integrated via central nervous system. So central nervous system like work as a major centers involved, right? So first is a like cerebral cortex. Cerebral cortex is a main functions for a conscious control of a postures. Cerebellum actually working as a coordinations and a balance is the most important for a balance equilibrium, and red nucleus working as a muscle tone regulations, and vestibular nucleus is a working as a balance control, and spinal cord working as a reflex postural adjustment. So it's a very important. Please take your screenshots. Central nervous system I think is a clear like as a working as a all informations integrated. Okay, so these all are structures. So now come to a very important part like this is a field from a diagram. This is a circular way. Okay, so all are summations like mechanoreceptors, proprioceptions, vestibular information and visions, all are a sensory system. So get the informations from bodies to send to the CNS. CNS give a motor's command, and the CNS is a biomechanical constants like postures maintenance. Okay, so these all are sensory receptors. Now come to a proprioceptors. So role of proprioceptors. So postures control is impossible without a proprioceptions. Proprioceptions like a sensors of a skin surface. Okay, so muscles spindle like detect change in a muscle's length and stretch, and Golgi tendon organs like detect a muscle tensions, and joint receptors provide informations about a joint's movement, and this information is sent to a central nervous system. Okay, so proprioceptors like help in maintain postures and a balance. Now come to a postural reflex. So two important postural reflex are important like stretch reflex and rightening reactions. So first is stretch reflex like help in a maintain of a muscle tone, and rightening reactions like help in a restore normal postures when a balance is disturbed like a restore as a erect postures. Okay, so rightening reactions as a working like protective reactions prevent as a falling. So these reactions are very important clinically and especially in a neurologically patients. So this will help in a body maintenance. Okay, so now come to a very important part is a pattern of postures alignment. Posture's alignment means a posture maintenance. Posture set to be a good when like maximum efficiency and the minimum effort from a body. So it's called as a good postures. For a good postures, sorry, as a spelling mistake. Good postures, the line of gravity should pass is specific for a body landmark. Okay, so an ideal postures is which the body segment are aligned vertically and allows it pass the all joint axis. So now let's us about a line of gravity means a allozy. So now let us talk about a line of gravity. Is extremely important. So line of gravity is is an imaginary line. So you can see in this diagram, this is an imaginary line, is a line of gravity, like vertical line passing through a center of mass of the body. So in an ideal standing postures, the line of gravity pass through the like a head, cervical, shoulder joints, hip joints, and spinal conditions, knee, ankles. So, in an ideal standing position's line of gravity is a slightly anterior from the ankle joint. So, first is a seen there's a head region. So, head region actually line of gravity pass is a external auditory meters. Okay, and cervical like line of gravity pass body of cervical vertebra, and shoulder joints like a line of gravity is a pass as a acromion process, means anteriorly. Okay, and thoracic like thoracic body of thoracic vertebra, and pelvis like slightly posterior to a hip joints. Okay, you can see this line of gravity is a pass posterior to the hip joints, knee slightly anterior to a knee joints, and ankle slightly anterior to a lateral malleus. So this is a as a erect postures, as a good postures like line of gravity is a passes through. If you like disturb during a assessment, you observe a side view. So side view is the best view for assess a line of gravity if a posture is a faulty postures or a bad posture. So you think clear like a line of gravity is a disturb. Okay. So line of gravity is a passing in which region? Now come to a very important part as a posture's impairment senior. So posture's impairment develop to a prolonged faulty postures, muscles imbalance, and a sedentary lifestyle or a occupational stress. So posture's impairment means a deviations from ideal postures like a lordosis and sway back and a kyphosis and a scoliosis. Okay, and a cervical postures. Okay, so all are developed due to prolonged faulty postures, in muscles imbalance, sedentary lifestyle. So it's like lead as an abnormal stress on our muscles and joints. So it can cause pain, fatigue, and reduce a functional ability. So common in a cervical, thoracic, and the lumbar regions. So now come to one by one discuss. As a first is a lumbar lordosis. So lumbar lordosis is like a excessive inward curvature of a lumbar spine. It's like commonly seen as a abdominalis muscles, tight hip flexor muscles, and anterior pelvic tilts. So lordosis is excessive inward curvature of a lumbar spine. Okay, so patients like spine is like this. First you see this diagram. Okay, so this is a lordosis. So lumbar spine like a एक्सेसिव इनवर्ड अंदर की ओर चला गया, एक स्कार्व टाइप हो गया. Okay, so this commonly due to like weak abdominis muscles and tight hip flexor muscles. So tight hip flexor like commonly in a lordosis, tight muscles seen as a iliopsoas, erector spinae, and weak muscles common as a abdominis and the gluteus maximus. Okay, so this is a lordosis. And lumbar lordosis like there's an anterior pelvic tilt and increase lumbar extensions. Common is a weak muscles and faulty postures common in a pregnancy and obesity. So cause of lordosis: poor postures habits, sedentary lifestyle, pregnancy, obesity, and weak abdominal muscles. So biomechanics of lordosis like increase stress on anterior longitudinal ligaments, of a spine, and posterior intervertebral disc space become a narrowed. Okay, so seen as a conditions like disc space are narrowing, and fascial joints common cases as a increase compressions and lead to a low back pain. So is a very common cause seen other patients like a PIVD case and compressions case, facial joint compressions. Most common case here, like a back pain. Okay, so if you assessment like clearly, so I think you diagnose easily. Okay, so now come to muscles imbalance in a lordosis. So I think is a clear like tight muscles seen as a hip flexor, iliopsoas, rectus femoris, lumbar extensor muscles, and big muscles actually seen as a rectus abdominis muscles, transverse abdominis muscles, internal and external oblique muscles, and big gluteus maximus also contribute to a lordosis. So the imbalance is common cause of low back pain. Maybe low back pain as a sway postures, and compression scene is a like PIVD scene, disc wall scene. Okay, so this all as a faulty postures. Normal postures, I think, is a clear is a line of gravity. Okay, and this is a round back curve. Round back postures like seen as a kyphosis conditions, flat back, and this is a lordosis, and this is a kyphosis. Okay, this all as a faulty postures. Now come to a thoracic regions. Thoracic kyphosis like present as a rounded shoulder and forward banding of thoracic spine. So excessive outward curvature of a thoracic spine. So seen this is a normal, and this is a kyphosis. So kyphosis like a rounded shoulder and forward head postures, and increase like strain on a thoracic vertebra and may affect as a breathing capacity. Because in a kyphosis is a common chances and common symptoms to a breathing problem. Okay, so may affect as a breathing capacity. So now in seen is a scoliosis in a thoracic region. Scoliosis like a lateral curvature seen as a spine and with a asymmetrical muscles activity. So there are two types, structural and a non-structurals. Okay, so structural scoliosis like a fix with a vertebral rotations like need to a surgery, and non-structural scoliosis correct via physiotherapist like scoliosis, postural scoliosis. So scoliosis is a lateral curvature of a spine, so you can see this diagram, and postural scoliosis is flexible and correctable, and structural scoliosis is fixed with the vertebral rotations. It's may caused by a neuromuscular disorder. So I already discussed in detail scoliosis, lordosis, kyphosis, any of spinal conditions like in a detail ortho third year orthopedics and a fourth year like physiotherapy management. So link available on a description box. After this class, you can check now. And now come to our next is a cervical postures dysfunctions. So cervical postures dysfunctions commonly present like as a forward head postures. You can see this forward head postures like head lies anterior to a shoulder line as a line of gravity के anteriorly चला जाता है, and there is increase upper cervical extension, and there is flattening of a lower cervical spine. Okay, so most common imbalance seen in the cervical region like tight muscles and big muscles. So tight muscles seen as the upper trapezius, levator scapula in sternocleidomastoid, and big muscles seen as a deep neck flexor muscles. So this imbalance like create as a neck pain and a headache. So it's common in a student and teacher and mobile जो भी यूज करते हैं, जो भी डिस्क पे काम करते हैं डेस्क पे. Come to a pain mechanism in a postural disorder. So pain in a postural disorder seen as a due to muscles fatigue, prolonged contractions, muscles spasm, poor alignment like a faulty postures, and any of a compressions. Okay, so muscles fatigue due to prolonged contractions is a pain mechanism, and ligamentous in strain due to poor alignment, joints compression seen as a altered biomechanics, and nerve irritations due to a foraminal narrowing. Because it's all a factor of a pain mechanism. Now come to a very important part is a postures corrections education. So how to correct postures? So postures correct include like patient educations, ergonomics advice, stretching over tight muscles and strengthening over weak muscles, and like a postural re-education exercise. Okay, so it's a very important as a postural corrections. Postural correction is not a single exercise or a not a single sessions of a treatment. It's a continuous process like involved with a awareness and muscles re-educations, ergonomics modifications, and long time as a habit change. So always remember, postural correction is a combinations of education and the exercise. So first, postural awareness is very important. If like most of the patients do not even realize that their posture is a faulty postures, right? So as a therapist, your first role is make the patients aware of a faulty postures, like when a muscles involvement and over activity of the muscles. So you can using like mirror and a photograph and a video analysis, so basically patients like understand these postures and corrections is become much easier, right? So is a first step like a postural corrections. Next is a muscles imbalance corrections is a second step. So muscles imbalance, how to muscles imbalance, like us, some muscles become a tight and overactive, or some muscles like a beak. So postural corrections follow a simple rule. First is stretch to a tight muscles and strengthening to a beak muscles. Okay, so stretching used muscles like a shorten due to a faulty postures, right? सो सॉर्टिंग हो गई तो आप क्या करेंगे, टाइट मसल्स को आप क्या करेंगे, स्ट्रेच करेंगे, लाइक जैसे कि अपर ट्रैप्स मसल्स, लेवेटर स्कैपुला, पैक्टोरस मेजर्स माइनर, इलियोसास, हैमस्ट्रिंग. सो स्ट्रेचिंग like provide a slow, control and pain free for a 20 to a 30 seconds, right? Never force in a stretch, like especially in a patients with a pain conditions. And strengthening actually done for a muscles that are weak and lengthened muscles. So common weak muscles seen as a deep neck flexor muscles, lower trapezius, rhomboid, abdominis muscles, gluteal muscles. So strong, like strengthening should have focus on endurance, low resistance, high resistance, like high repetitions. Okay, so should have focus like endurance, low resistance, and like high repetitions. So muscles strengthening, I think, is a clear use for a big muscles, and muscles stretching exercise for a tight muscles. Okay, so it's very important. And postural re-education is also important. Like postural re-education means training the patients to maintain correct postures during our daily activities, like correct sitting postures, correct standing postures, correct walking postures, correct lifting techniques. So patients should be trained to hold correct postures for a gradually. Okay, it's help like developing new motors patterns and used to a mirror for this training like educations. So postural re-education is a very important part. Next is a functional training. So like postural corrections should be integrated into functional activities, like learn to sit correct at a work, and bend and lift object like correctly, use a mobile phone and a laptop with the proper postures. So all are help in postural corrections. Taping is a very useful for a postural corrections. Myofascial release is also important in a correct postures. Some of modalities and massage used for like pain relief, relaxations technique use. Okay, so and ergonomics advice is very important for a postural corrections, like sitting postures and disc and chair ergonomics. Like chairs should be support the lumbar spine, and height is a adjustable height. Disc height should be elbow at a 90 degrees, shoulder relax. Okay, computer and laptop ergonomics, like computer screen should be at a eye level, arm length distance, and like keyboard and mouse should be close to a body. So is ergonomics. This ergonomics like help in corrections of our postures and prevent to a faulty postures. Okay, mobile phone ergonomics, because mobile phone mostly all are use a mobile phone. So excessive mobile phone use cause of forward head postures is also called as a like a text neck. So patients should be advised to raise the phone at the eye level and avoid bending the neck. Okay, and take a frequent break. So this advice is extremely important for our young patients. And standing postures ergonomics, like during a standing bed should be equally distributed on both feet. Knees should not be locked, shoulder relaxed, abdomen should be gently engaged. Okay, so these all are very helpful for ergonomics advice, like postures corrections. And sleeping ergonomics is also affect our postures, like mattress should be a firm or a shape, pillow height should be maintained in a neutral cervical spine, side almost as a side lying, and supine positions are preferred, prone lying should be avoided. Okay, and lifting ergonomics, so lifting ergonomics is important when lifting any object, so bend at a hip and knee, not at a spine. Okay, avoid any of twisting movements. So is all advices are very useful. So I think as a clear now all about the postures. So postures are very important for biomechanics. If you assess any of the patients, so is a very important. And as a physiotherapist, your role is not only for treat a patient, but it's modify a lifestyle and prevent any of a recurrence. So thank you so much, and keep supporting me. If you helpful to this video, so don't forget to like, share, and subscribe. And next videos I will cover as a 50 MCQs on a postures. So thank you so much, and keep supporting me. Bye bye. Take care.